y'all. Welcome back to the Dental Hygiene Basics podcast. My name is Dana. I am your host. Excited to be here. It is summertime and sun's out, guns out. I feel like I've always been kind of embarrassed about my arms. If you're watching on the YouTube right now, you can see that I'm wearing a tank top and I'm showcasing my muscles, and they're getting stronger because I'm getting stronger. Something that I committed to starting earlier this year was Pilates, and I've been really impressed by how much stronger I've gotten. It's hard, y'all. Like, it is so hard. I've been doing this for months, and every day I'm like, I'm going to get better, right? Like, eventually it's not going to be so hard. That day has not come yet. It's been really great to kind of see the strength transform, to be able to see myself, like holding a plank for longer, albeit it's still not very long and I still do modified planks. But thinking about where I started before, many of you know I had surgery for endometriosis, and, it was kind of like starting from square one. I really had not been able to properly exercise for years and years, and I'm rebuilding all of my core strength, of which is lacking completely. But I will say, from all my years of slaying calculus, like, these guns are still strong. I'm pretty proud of myself. And yeah, so, it's summertime, sun's out, guns out. So we're excited. Okay. I want to talk a little bit today about what I would say to a patient if I was explaining periodontal disease to them. Now, remember, periodontal disease includes both gingivitis and periodontitis. I see that confusion a lot, especially in dental hygiene students. There are basically different classifications when you're diagnosing a patient, right? You have health, gingivitis, periodontitis. Gingivitis and periodontitis both fall under the umbrella of periodontal disease because they both affect the periodontium. However, they affect the periodontium in different ways, right? So gingivitis is inflammation of the gingiva. It only affects the gingiva, whereas periodontitis is inflammation of the periodontium as a whole. In order to really understand that, you kind of have to go back to dental anatomy and early anatomy of maybe in your perio class to remember that the full periodontium includes the gingiva, the periodontal ligament, the cementum, and the alveolar bone. Okay. Those are the four components. And what does that mean? It's essentially what holds the tooth in the socket. Okay. And if you start to lose any of those structures, then you are at risk of losing teeth. So that's a little taste of what I might explain to the patient. But I got to a point where I had such a good explanation that served me, because as a dental hygienist, you really have to be good at education, and everyone is going to explain things differently. But I remember when I got started, I really did not know what to say to the patient, and I didn't know how to explain it to them. But as I started growing in my studies during dental hygiene school, I really wanted to put in the effort to know the material very well so that I would feel confident talking about it to the patient, because I knew the patient was going to ask questions, and they do. And you're going to get questions that sometimes you just straight up don't know the answer to. Or you may say, you know what? I learned that back in dental hygiene school, but I haven't dusted that off in a while. Let's look it up really quick, and we'll answer that question, in a good way. But if you have the baselines down, right, you have to be able to educate your patient on their diagnosis and explain what their treatment plan is based off of that. Otherwise, you cannot get informed consent. Okay. What does that mean? Informed consent means that the patient is informed and they are consenting to treatment. But they can only be truly informed if they know their diagnosis, their prognosis, if they know, what the treatment's going to entail, alternatives, benefits, risks to treatment. They need to know all of that. And at the end, they need to have the opportunity to ask questions. If you do not provide all of that when you're educating and explaining what your patient needs, then they truly cannot give informed consent. And they could come back later and sue you and say, I didn't know what I was signing. I didn't know what I was doing. They never told me that, so that's where, unfortunately, as a healthcare provider, you do have to go above and beyond. The best way I ever heard it described, someone said to me, inform before you perform. Inform, inform, inform. You'll hear me if I'm treating a patient. I literally never stop talking. And it's not because I'm just gabbing, although I do gab. It's more of explaining what I'm doing. And I don't care if it drives the patient crazy, but the patient is always going to know what I'm doing. And that really is beneficial if you get in the habit of it now, especially if you have patients who maybe are blind or they don't see as well, because then you're explaining what you're doing and there's no surprises, right? Like, if you just start leaning the chair back and the patient is blind and they don't know that you're leaning the chair back, like, think of that experience from your own situation, right? So if you can inform before you perform, it actually benefits you in many ways and gets you ready and set up for a lot of situations. I actually think that's why I've been very successful in pediatrics as well, is because I explain everything to the child. Now, everyone's different. You have to feel out the situation. Some people are like, hey, I don't need the play by play, but really, the operatory is my room, right? That is my space. And I like to take control of it. And I like to do what I know needs to be done to educate the patient, make sure they're on track, but also to protect myself as a healthcare provider because, there are risks, right? There's risks of malpractice, there's risks of, perceived negligence, things like that. So we want to protect ourselves. And most issues, most lawsuits do come down to miscommunication where the person really did not feel like they understood or knew what was going on. So that is why informing before you perform and also giving them the opportunity to ask questions, but also explaining it in a way that they understand and can see it and understand it, that is going to help not only give them the empowered feeling that they are choosing the right treatment for them, but it's also going to improve your treatment acceptance. When you're in dental hygiene school, for the most part, people are probably going to be like, okay, sounds good, especially if, your clinic is a free clinic or if it's very low cost, most people don't think twice. So like you're saying, this is what I need. Okay, let's do it. But when you get out into private practice, if you're telling a patient your treatment plan is $2,000 for, this, and that, and the other, that's going to take some convincing, no matter who it is. Okay. And I truly mean that. You're going to get some patients that are like, okay, I understand. I don't want to do it, but I need to do it. Or, oh, that's a lot of money, but okay, I get it. I rarely had like treatment not be accepted. It was like very, very rare. And you come across those patients every so often, and they're like, I just want a regular cleaning. And I'd have to have that tough conversation with them. Hey, listen, that's not how this goes. This is what you're asking me to do. And usually it would get to a point where they would understand. Okay. And maybe it didn't happen all at once, right? I think we have to give our patients a little bit of grace. We don't know what they're going through. We don't know their health literacy. And we also don't know how much they trust doctors, what their values are. There's so many things to consider. Okay. I really didn't think about these things in the way that I approach patients so much. And I mean, I was doing it this way. I was thinking through all these things, but I never really started to think about the other person's perspective as much on what they may be experiencing until I started having health issues of my own and, starting to kind of have a distrust of doctors because I wasn't listened to, or people said, I didn't have endometriosis when it turns out I had very severe endometriosis. And so you can get jaded in the healthcare system really, really easily. And we add insurance into all of that. It's just such a mess. So what can we do to bridge that gap between what our patients need and making sure that they understand and they trust you? That is where it comes down to having a solid foundation of education and getting comfortable teaching it. Okay. So, a couple of things I want to start out with. One, when you're in school, when you're studying, I want you to think about how is all of this information directly applicable to my patients. And you may think it's so small. You may be like, oh, the inner lining of the mouth it's all stratified squamous epithelium. That's the type of tissue it is. Okay. Why is that relevant? Because the most common oral cancer is squamous cell carcinoma because it's squamous cells that are lining the inside of your oral cavity. So it makes sense that that's the most common type of oral cancer. So when I'm screening my patients for oral cancer, I can be having these conversations with them. And I'm also, working and studying at the same time because I'm educating them. Now, you don't want to freak people out. Don't say you might have cancer. You know what I mean? But I want you to be thinking about those things, even if you're not saying them out loud. As you're looking at the tissue, be thinking about that, right? How is what you're learning in classroom applying in clinic? And what can you directly apply? And I mean, use it, apply it, and get comfortable having those conversations with the patient and thinking through what am I actually looking at? Because I think it's very easy to get to a point where we kind of forget that baseline and we just narrow in on like what we think is important. But we can really use that to enhance our patient's experience. Okay. And the other thing is the more you know and the more you practice saying these things out loud, even if it's rocky, even if it's shaky, trust me, when they're coming into the dental hygiene clinic, they know you're nervous. You're going to fumble on your words. That's the place to practice. I find that a lot of students, like they don't realize until they get out that they're like, I should have been having more conversations with my patient and practicing explaining what I know. Okay. A lot of times I find students will just be like, here's the treatment plan, and the patients will accept it in dental hygiene school. You don't have to spend that much time explaining it because of, the situation. But when you get out, you really have to educate to be able to really explain to the patient why they need what they need. And if you're not doing that effectively, you will not have good treatment acceptance, and you will struggle to build that rapport with your patient. So, sometimes I get a little frustrated when people try and go the easy route. They're like, what do I absolutely need to know to pass this class? Where are the answers on Quizlet? Where is this? Instead of really thinking that this is my future career and everything I learn here is directly related to the patient. It could be a matter of life or death. I'm not saying this to freak you out. It's the truth. I could miss something. I could not recognize something like cancer, right? I may miss a lymph node because I didn't practice it enough in school, or because, I just thought it didn't matter that much to do an extra oral screening. These things matter. Like, you are a healthcare provider, and that's what we're supposed to do, is help and heal. Okay. So I really want you to take a lot of stock in that. And when you are going through your education, I really want to make sure that you are putting in the effort and then practicing it. Okay. The other beauty about practicing things and saying it out loud, if you're teaching your patient, you're teaching yourself. What you're doing is practicing active recall, which I talk about all the time on the podcast. Teach it to somebody else. That's how you're going to learn it better. I felt like I really got the hang of this in dental hygiene school, so much so that one time a teacher pulled me aside after clinic and said, "You are really great at educating the patients." And that meant so much to me. And granted, we all know I was going to go on to be an educator. So obviously, like, it is a part of who I am, right? I'm a little bit born this way, but it did not come naturally. I used to have a huge fear of public speaking. I still do. Like, if I have to get up on stage in front of people, it makes me very, very nervous, but it's gotten better over the years because I just keep forcing myself to do it. That's how it was when I was talking to the patient. I remember a time period where I knew I had to educate the patient and I didn't feel comfortable doing it. But I was like, you know what? We're going to do it anyways. And each time it got a little bit better, a little bit better, a little bit better. I'm also blessed to have gone to a program that was huge on oral hygiene instructions. Like, we had to do that every single time. We had multiple competencies on it. Okay. So I want to talk to you. What would I say to my patient who has periodontal disease? Okay. This is a script that I came up with that I use all the time and I had really good success with. You may alter it to your own needs. That's totally fine. This is just kind of a blanket what I start with. So after I do all the assessments, and granted, I'm informing before I perform. So I explain to the patient, I'm taking photos of all of your teeth. I'm going to show you some things, and then I'm going to assess all of your gum tissue to see how well attached your gums are to your teeth. That lets us know how healthy you are. And I'm going to evaluate your x-rays to see if we have any issues with the bone, because again, that lets us know how healthy you are. So I go through all of that and I say, if you have any questions, let me know. And if you have any sensitivity, let me know. I'm explaining, I'm telling them everything so they know exactly what to expect. Okay, so I get through all of that. And then I'm in my head, I already know what the diagnosis is. As you get better, you're going to know, right? You're going to be like, this is perio, or this is gingivitis, or this is health. Yes, you're going to have to classify in your note, what stage and grade is it, and maybe think about some extra things beyond that. But in the original baseline, you're really just trying to decide, like, is it a healthy patient? Is it a gingivitis, or is it a perio patient? And if it's a perio patient, how severe is it? Like, is it something I can manage here in the office, or is it something I'm going to need to refer to perio? If we're getting into like stage 3, stage 4, depending on the scenario, we may need to get them over to the periodontist first for evaluation. Okay, so let's say that I'm evaluating, I determine that my patient needs perio. I think it's something I can manage, and I'm going to manage it with non-surgical periodontal therapy, which includes cleaning, all of the teeth. Some people refer to that as scaling and root planing. Okay, I'm ready to educate my patient. So I sit them up, and as I'm sitting them up, what I'm doing, taking off my gloves, washing my hands or whatever. And then I have a little flip book, right, that shows the periodontium. And what I say is, so in your mouth, you have 4 things that hold your tooth in, right? You have your bone, your ligament, and your cementum, right? And your gum. Okay. So I tell them, like, what exactly is holding the tooth in. I say the problem is when bacteria grow on our teeth, your body does not like that. So your body goes into panic mode. We see the earliest signs of that. Your gums get red, they're bleeding. Your body sends blood to the area because blood has fighter cells that help fight off the bacteria. The problem is the bacteria are growing on the outside of the teeth, and it's really hard for the blood to get there and really do an effective job. The only way we can remove that bacteria is to physically remove it. Well, if we don't, that bacteria keeps growing and it gets below the gums where we can't see it. Your body really doesn't like that. So over time, your body goes, you know what? We can live without teeth. Let's get rid of the bone, get rid of the ligament, get rid of the gum, get rid of the cementum, and get rid of the tooth. That's what your body thinks. Your body knows you can live without teeth. It would rather live without teeth than live with that bacteria because it's essentially an infection. So think about it like your body trying to push a splinter out of your finger. Okay. Now, thankfully, our bodies are very slow at this. You're not going to wake up like overnight and have lost a tooth on your pillow, right? It takes time for this bone loss and this gum loss to occur. But I do see that that's been occurring in your mouth. Okay. And then I would go into explaining, looking at the x ray, your bone should be here, but instead it's down here. So you've lost about 20% bone. When I do your measurements should range between 1 to 3 millimeters. If you look at your period chart, do you see that there are many numbers in red ranging from 4, 5, and 6 millimeters? And the level of attachment that you have lost is, ranging anywhere from like 2 to 10 millimeters or whatever. You're explaining like you've lost a significant amount of attachment or you've lost a little bit of attachment, but we've caught it early, right? And so what we need to do is we need to get in there and mechanically remove that bacteria. That is the only way to stop or to, halt this from continuing forward. But it's going to be a relationship between the two of us because your job at home is to remove the bacteria above the gum line with your toothbrushing and your flossing or water picking, whatever I'm recommending. My job is to help get the stuff off that you can't get, right? You can't maintain at home. So it's going to be teamwork between the two of us. Your job is to go in and demolish those bacteria every single day. So the bacteria, they like to build a house, then they build a city. And if you don't go in and bulldoze that house every day, next thing you know, you're going to have the United States of America of bacteria on your teeth, okay? Those bacteria do not just stay in your mouth. They break off and they travel to different parts of your body. Okay. You swallow it. So they have found this bacteria in the digestive tract. They linked it with esophageal and stomach cancers. They found it in the lungs. It can lead to pneumonia of the lungs. So we know that this bacteria can go elsewhere and cause problems. We need to get this off for the health of your teeth, your gums, your bone, but also for the health of your entire body. Okay. So managing this infection is going to help get you closer to overall health. All right. So how do we do this? We need to go in and we need to remove all of the bacteria both above and below the gum line. I use a combination of a powered instrument and hand scalers. Okay. There's different ways that we can manage your comfort during this procedure. We can see how you do. If you don't want to do any, numbing or anything like that, but we also have topical numbing, which is like a gel that we put on, wears off in about 20 to 30 minutes. Or we have full numbing, which would require an injection, but you would be very comfortable, right? It's up to you. We can try one, move into the other. We have options, right? From there, you have a good prognosis. You've only lost, 15% of bone. With that, you have plenty of bone to keep your teeth the rest of your life. However, it's going to require routine maintenance every 3 to 4 months until you're stable. And even then, you'll still be on a 4-month recall receiving maintenance therapy because you've had history of this disease. What we have to do, stop the disease and prevent it from getting worse and coming back. And that's where that teamwork comes in. Okay. Now, risk to the procedure. Main risks, the gum tissue will tighten, it will settle down. Sometimes that could potentially lead to an abscess after treatment. So if you have any unusual pain, discomfort, sensitivity, please let us know. A little bit of discomfort, sensitivity, the teeth may look longer after we remove all of this because you're going to see more of the tooth and the gums are going to shrink down. So the teeth may look a little different. You may feel spaces between your teeth as I break off those bridges of bacteria that connect them together. That is normal. It is going to feel different to you. I promise you, I'm not taking off your tooth. I'm just taking off the bacteria that you don't need there. Okay. Benefits to the procedure, right? We remove all of this stuff and then, ideally we'll start to see healing. We will bring you back for a 4 to 6 week re-eval so we can assess to see how well this worked. Again, it's going to be teamwork between the two of us to get to the optimal results. At that point, we will reassess and see if there's anything else additional that we can do, such as potentially local antibiotics in the site, or maybe a referral to a surgeon or specialist if we feel that that's needed, if sites aren't healing the way that they're supposed to. Okay. This is an ongoing evaluation to see how you heal. And from there, we make, more decisions as needed. What we are hoping for is that we get to a point where the gum tissue goes down, swelling goes down, bleeding stops. That would be the ultimate final goal for us. Okay. But it's going to take cooperation from the both of us, right? So this is the treatment plan that I'm recommending. We have, 4 quads of scaling and root planing. I would recommend doing the right side and then coming back for the left side. At that appointment for the left side, we'll reevaluate the right side and kind of see how it's doing so we can get an idea of how you're healing and if we need to make adjustments. Each side will probably take an hour to an hour and a half. And, depending on if you're numb, you may have to eat soft foods, be gentle and chew on the other side during that time. Do you have any questions for me that I can answer for you before we dive in? And then you let them take the floor. Now, that feels like a lot. I just gave you like literally the whole spiel. During this time, you're interacting with a patient. So you're explaining, but you may be asking them questions or do you see that? I just want to make sure you understand this and that. But that whole thing probably took 5 to 6 minutes. And I know you're thinking that is precious time in the appointment, but where you're going to get to eventually, like if you practice this enough in dental hygiene school, you get to a point where you've got your spiel, you know what you're going to say, you know how to explain it to the patient, and then it just starts to get a little bit shorter and more concise. But notice that I did not leave out any education whatsoever. And I also want to mention that during this time, I'm using a lot of visual aids as well. There's plenty of great visual aids out there on the market, but I just want you to keep in mind that that is what you have to have for informed consent. You really have to lay it out there on the line. What is their diagnosis? What do they need? Risks and benefits, alternatives. That's the one thing I think I didn't say, but usually I'll roll in and say, there's really no alternatives to treatment. Like we have to get that bacteria off of there. But some of the things that, we may vary would be like, do you want topical over local anesthetic? Or do you want hand scalers versus powered scalers? And that's to say, some of that is going to depend on what's best for them as well. Okay. And yeah, I know it feels like a lot. That was a big, long spiel, but I hope you take bits and pieces of it and make it your own and start to just say it out loud. That's really how we get comfortable with it. Fight through the awkwardness. It's going to be there, but I know that you can do this. So get out there, educate your patients. Remember, the role of the dental hygienist is rooted in education and prevention. We were meant to get out there and mobilize in the community and prevent disease. And that starts with educating our patients. Okay. So I am going to encourage you all to be incredible educators. Have an amazing day. Best of luck on your journey, future registered dental hygienist.